Welcome, everybody. We're glad to have all of you join us today to today's roundtable talk. And on behalf of our entire organizing team at the NVFC, I'm delighted to welcome you to the Volunteer EMS Recruitment Retention Roundtable. So today we're coming together to kind of talk about our shared mission to strengthen our volunteer emergency medical services by addressing some of those critical issues that we face with recruitment and retention. And your presence here, just attending, this roundtable today, that's just a testament to your dedication and your passion for ensuring that your communities receive the highest care of services. So thank you for being here. And throughout this roundtable, we really aim to foster an open exchange of ideas and strategies and experiences. So at the end, you're going to have an opportunity to ask questions of our great panelists. And speaking of that, I am so excited about the group that we have here joining us. So we're happy to have our experts here with us. And I'd like for each of them to introduce themselves very quickly. And I will start with the NVFC's board director, Mr. Eric Quinney.
Thanks, Candace. My name is Eric Quinney. I'm the Wyoming State Director for the National Volunteer Fire Council. I'm the Chief Administrative Officer for Uintah County Fire and Ambulance, located in Evanston, Wyoming. I also currently serve as the President of the Wyoming Fire Chiefs Association, and I'm the Chairman of the EMS Rescue Section for the NVFC. Glad to be here.
Thank you, Eric. And Eric is very humble. Eric does so much for our EMS community. A lot of the resources and things that you see come out from the NVFC, Eric's had his little touch on. So we're very grateful for his expertise and his involvement and his time that he volunteers to all of us to serve you. So thank you, Eric. So next up, we have with us our friend from Iowa, Pam Rogers. Pam, you want to introduce yourself?
Yeah, I'm Pam from Idaho.
Oh, I'm sorry.
Very different from Iowa.
Which is where Jules is from. Whoops.
Right.
So
My name is Pam Rogers. I'm
those two confused.
the volunteer coordinator for the city of Moscow, working with the Moscow Volunteer Fire Department in the Idaho Panhandle. I'm in a pretty rural area. I've been in volunteer EMS for about 15 years and in my role as a volunteer coordinator for 7 years. And yeah, I'm happy to be here.
So Pam is absolutely phenomenal. We've had an opportunity to get to know Pam through different events, and Pam sent us over this great folder, all these great photos that her department and her organization is doing. And let me tell you what, they are absolutely phenomenal. And I can't wait to hear what Pam has to share with you today. So thank you, Pam, for being here with us.
Thank
And
you.
next up, we have the Queen of EMS, Jules. So Jules, would you like to introduce yourself?
I don't know about Queen. I have been in this for 30 years. My name is Jules Scadden. I'm the director of EMS for the Dysart Ambulance Service, which is a blended mostly volunteer ambulance service in central Iowa. I've worked for both paid and volunteer ambulance services. I started out as a volunteer and did that for 15 years and then moved into the paid side of it and kind of did both for a few years. And I've been involved with various organizations in EMS and been with NVFC. Started out with NVFC Rescue Section as when I was on the board of NAMT, I was the liaison to NVFC, and then morphed over to being full-time with NVFC in 2013 because I just really have my hearts with volunteers and I really believe in this organization. So I've been vice chair with NVFC pretty much since 2013. And I just really believe this organization does a lot, heart and soul, for the volunteers. So pretty excited to be a part of this.
Well, thank you, Jules. And the reason that I like to call Jules our Queen of EMS is that Jules represents all of us. And when I say us, I mean the EMS community as a whole across the country on so many important boards. And she volunteers her time to do that. And we're very grateful for all that she does to make sure that the volunteers have a voice. So again, thank you, Jules, for being here to share your expertise. And thank you for all that you do for the NVFC. And as Jules mentioned that she joined as she was part of our EMS rescue section. If you're not part of that section, that is something that you can join for free as an NVFC member. So reach out to us, ask us how to get involved because we have a place for you. We have an area for you to get involved. So we need you as a member because we want to hear your voice. All right. So today's discussion will last about an hour, depending on how many questions that we get. We do have some prepared questions for our great panelists, and then we'll move into some audience Q&A. So if you think of a question, feel free to drop that in there. And when we get to that point, we'll make sure we will grab your question and turn over to our subject matter experts here to get an answer. So with that, we're going to go ahead and get started. All right. So recruitment and retention is so near and dear to my heart. During my doctoral study on recruitment and retention of volunteer first responders, I was so concerned on how we can address this issue because I know how important our volunteers are. And what a lot of people think is that money comes up, that we need to throw money up at people for recruitment and retention. Well, that wasn't what popped up in my study. It was actually non-wage benefits that showed up as a successful retention strategy. In fact, non-wage benefits outweighed any financial incentive. So we know money and a paycheck, that's not a successful method for retention. It's that having that heart of service. And we know that our panelists are, perfect examples of that with their departments and the what their members give. And so, Eric, I know in your state, you've implemented a lot of attractive non-wage benefits. Can you share a little bit about those and how they've been successful?
Yeah, you betcha, Candace. Thank you. Yeah, I think we have also found that non-wage benefits tend to be more attractive to people and not only the recruitment aspect, but also retaining people, which is equally as important as recruitment. One of the things in Wyoming is the creation of the volunteer EMT pension plan. This is a plan that's funded partially by the state and also with contributions from the local ambulance services that provide a retirement benefit based on the years of service that an EMT volunteers. For example, the first 10 years of service, the defined benefit is you get $16 a month for every year of service for the first 10 years of service. And then after that, that increases to $18 a month for every year of service past 10 years. Then you're eligible to draw that benefit at the age of 60. So if you have, for example, 20 years of service as a volunteer EMT in Wyoming, your monthly benefit would look about $340 a month. Now, that's not a whole lot of money per se, but again, we're looking at this non-wage benefit as being something. So that once they're done volunteering being an EMT, now all of a sudden they have $340 a month coming to them as a partial car payment or a utility bill or things to help out in the retired part of life. It keeps people going that, hey, I do want to have, and then that benefit only goes up past 20 years of service. So we like to encourage people to volunteer as long as they can to take advantage of that.
And Eric, that benefit, I was just thinking, like, you take somebody, maybe they're at the point in their life, they're in their 40s and their kids are adults now, and they're looking for a way to fill that void. At somebody at that age group, there are retirement's important to them. So knowing, hey, I can, even I can join, and then this will be coming to me in 20 years from now. So that's another way to make that contribution.
No, exactly. And like I said, it's certainly a hook to draw people in, and then certainly a hook to retain people in knowing that, hey, every year that I continue to volunteer and be active will only increase this benefit that I'm going to get when I'm done serving. And I think everybody looks to financial status in the retirement years as being, something that they want to focus and plan on. And certainly we try to use this volunteer EMT pension plan as a hook and a retention tool for people here in Wyoming.
And if you don't have a plan like that in your state, and you're thinking, how do I start that? I always say to people, talk to someone like Eric. How did this work? How do we get something started in our state? Use the models that other states have created to help pave that pathway in your own state. And speaking of a pathway, you guys have an insurance plan too, right, Eric?
Yeah, actually, the state legislature this year just passed a brand new law in Wyoming that allows uninsured volunteer firefighters, EMTs, and search and rescue personnel to have access to the state health insurance group plan. Now, the volunteer has to pay the entire premium amount to have access to that group plan. But what it does, it allows for a more attractive benefit and cost a price point than searching for insurance on the open marketplace. So what this is exciting about that we were able to try to pursue is to be able to target those self-employed individuals that work in our communities. And especially here in Wyoming, we have lots of people that are ranchers and farmers and otherwise self-employed that can't afford health insurance at the prices that they might find them out on the open marketplace. So now, hey, become a volunteer EMT, and now you have access to the state health insurance group plan that comes at such a better price point for a family or individual. And so not only serves their insurance needs, but also helps us as an organization and recruit more people so that they have access to that plan and can be and find that more affordable insurance. So it's super exciting. This is just getting rolled out here in Wyoming, and be able to start targeting those self-employed individuals and people that don't have access to health insurance otherwise, and give them incentive to become an EMT or a firefighter and volunteer in the community to have access to that.
Yeah, I was just thinking, from Ohio, all of our and then being in a farming community, what an attractive benefit that would be for our state. And I want to point out, some of you on the call may be saying, "Oh, we're too small to do something like that." Eric, your state's not that big when it comes to population, right? So.
Yeah, I mean, we're certainly a big state in terms of land mass, but in terms of population, we're the least populous state in the nation. And so certainly we were able to, grassroots efforts to approach our state legislature to say, hey, EMS especially is at a critical juncture, and our staffing levels in many of our rural areas are suffering, and we need recruitment and retention tools. And that was a big topic in the interim last summer, to work with our legislature to come up with these ideas to help increase our recruitment and retention, to help our staffing levels, not only in our ambulance services, but also our fire departments and search and rescue organizations. And this was one of the fruits that came out of that labor of allowing people access to health insurance, and to those people that don't otherwise have access as a recruitment and retention tool. And so we're super excited and certainly able to we can share that legislation out with anybody that is interested in starting legislation in your own state to allow, because this costs the state nothing, right? All this is allowing is that the volunteer to pay the full premium and have access to the plan. It does not cost the state anything. The state is not paying anything on behalf of the volunteer. And we had several volunteers testify that, for example, the premium for their family of 4 for Blue Cross Blue Shield or whatever insurance company on the open marketplace was like $3,000 a month. And now through the state insurance plan, that was going to cost them maybe just $2,000 a month, saving them $1,000 a month. And that was a huge benefit, to be able to say, hey, yeah, I want to stay volunteering on this department, or I want to be a volunteer, because that's going to save me $1,000 a month for my family because I'm self-employed or otherwise don't have access to health insurance.
Yeah, that was a great creative solution to meet the needs of your stakeholders. And I think if your state's not doing something like that, we can definitely learn from that. And thank you for being willing to share that out. It's a great creative solution. And speaking of getting creative, let's talk about training. And so we know with EMS that our volunteers really struggle with, work-life volunteer balance, and training can be an issue. And the one study that I conducted, it showed that 70% of our volunteers state that they're struggling to balance their volunteer in their home life and their work life. 70%, that's a lot. And a lot of that has to do with the initial training and the ongoing training, that just kind of piles up. So we know that if it's not addressed, that we can lose people. Eric, what have you guys done to make that balance a little bit easier for your volunteers when it comes to meeting those training needs, and that way that you have a trained workforce?
Yeah, I mean, first and foremost, as many of you on this webinar know that the increased training requirements for EMTs, AEMTs, paramedics have you know, uh, gone way up since maybe many of us took our initial EMS training, and so that right there is a huge roadblock in those of us that rely on volunteers to provide emergency medical services in our community, because the out training requirement hours have gone way up, and that requires more people's time, and that becomes less attractive to many people by not having the time. And so one of the things that we have done here locally is we're over 100 miles from our nearest community college. And so it's not really realistic for people in our community to be able to take an EMS course through the local community college because of time and distance. And many of these people that are potential volunteers have other full-time careers, and their ability to go just to go to college to become an EMT is not practical. So what we've done is worked with our state office of EMS to be able to provide our own curriculum and training in-house at our local station. And right now we're in the middle of an advanced EMT class locally that we provide with our own instructors. We get our curriculum approved through the state office of EMS, and we're able to roll out that curriculum and have night classes at our local station and be able to kind of tailor the class around the needs of our students and our prospective EMTs. And by doing that, we're allowing people to become EMT certified, AEMT certified. In Wyoming, we still have an intermediate level that's not nationally recognized, but is a kind of a bridge between the advanced and the paramedic level to serve some of our rural communities with ALS service. But by providing that training in-house, we're allowing to be able to get away from the college, specific time during the day to take the class and tailor it to the needs of our students and our community members, and allow them to take the class, stretch it out over a length of time that meets the needs of the students. And by doing that, we're able to provide them the curriculum, get them ready to take the national registry test, and kind of just get out of that. Well, we don't have access to a community college because it's 100 miles away. And so be able to do everything in-house and provide the curriculum to pass the cognitive testing and psychomotor testing that they're needing. And then in the end, we are able to reimburse them the cost of the training as long as they join our local service and provide service. So by doing that and training, we're just kind of trying to be able to increase our ability to get people involved, because they can take small bites at the apple, and we can train them and specifically to our needs and in the time frame that works best for them, and to get all of our hours in. And so that's certainly been a huge help, is in-house training and working with our state office of EMS to do that.
Well, thank you, Eric. And I think it is important that we figure out, we work with, whether it be, our local colleges, our state training offices, whoever's providing that, figuring out how can we offer training that meets the needs of our volunteers, nights and weekends, that way that we can get our folks on board. So yeah, having those conversations is so important. Bringing training to our communities is so important. So thank you for sharing that. Let's transition over to Pam. So Pam, in the study I conducted, one of the things that came up was a need to shift our focus to meeting our volunteers, their needs, and to see to do that, that'll help improve our success and reduce our turnover. Can you share how you've embraced students as volunteers and kind of met their needs so that you could help fill your roster? How did you, shift away from that traditional recruiting and went to a meeting your stakeholders' needs so that they could successfully serve?
Yeah, so we, in the Moscow community, we have two large universities, which has helped us have an incredible pool of candidates that I know a lot of the other rural communities in our area don't have access to. As much as we want as many long-term community members as we can get, we really can't meet the needs of 27,000 people in our community with just community volunteers right now. We have an absolutely amazing group of student volunteers, or people who are affiliated with the university. About 60% of our 100 volunteers are affiliated with the university or a college student of some sort. Our department has 3 fire stations, and in each of the 3 stations, we have live-in dorms that full-time student resident firefighters live in. And most of them choose to become EMTs as well to meet the EMS demands, which, as we know, are roughly 70% of the calls of our nation and our agency. And they come to our department, interview once a year. We do a pretty extensive training or interviewing and testing process for those folks. They interview in March and they come and join us in August and live at the stations and in college dorms. It's considered on-campus housing for the university, which is pretty awesome. And then most of those folks stay with us for around 4 years, 2 to 4 years, depending on what stage we get them in. So we've got the live-in crew. This year we're bringing on 26. And I think half of them are women this year, which is pretty awesome. And they're an incredible asset to our community and our department. But outside of those 26 volunteers, we have another 30 to 50 volunteers, depending on the cycle, because we kind of run on an academic cycle with our volunteer onboarding. We have a significant amount of student volunteers who are pre-med or wildland, and we don't make our volunteers do both fire and EMS. They can choose one division or the other. And like Eric was mentioning about offering training opportunities, we do evening classes for EMS twice a year, Fire Academy at least once, sometimes twice a year. So we're constantly training and kind of embracing the fact that retention efforts for those crews are kind of lost to a certain extent. Not lost. Retention is absolutely important with them, but we know that when we get them on our department, they're going to be there for 2 years to 4 years. Some stick around forever, like myself, and but we kind of embrace the fact that we know that we're going to lose them when we bring them on, and we're pretty strict about how we interview and pool those and select those candidates. So.
No, yeah, you brought up a lot of great points, and some things I want to point out that you brought up is, one, you're offering the non-wage benefit you're offering. You have the dorms. What an attract, you know what I mean, and housing. Being able to provide them some housing. What a great partnership that you've been able to establish with the college. The other thing that you mentioned is that they're there for 2 to 4 years, and I think for a long time in fire and EMS, we had this philosophy that everybody has to stay with us for life. But wow, if you can take pre-med or you can take nursing students or whoever, get them for 2 to 4 years, and then when they go out into their jobs, they're going to be our biggest advocate. They're going to be able to say, and we can sell them on that. A lot of states, and I look at our state, have the paramedic to RN program. My husband went from firefighter paramedic to RN, and now he's running a level 1 trauma center. But it started with the volunteer fire service. What a great avenue that we have to offer people. And I think it's important that we move away from that. You got to stay for life. But if we can get you for 2 to 4 years and you can then go out and be a voice for us, that's a total win for us and for our folks. So yeah, rethinking that is so important. I think that's great that you guys are doing that. And looking at that and having such a program, we know setting expectations for volunteers is important. And that should really go to the recruiting phase. And that actually, that trend popped up when I did my study as well. So what are your thoughts on setting clear expectations and identifying the role of our volunteers as we're bringing them on, keeping it real with them?
Absolutely. As much as we'd love to give every applicant the opportunity to volunteer with us, we do say no to a very significant amount of pool. And I know that we're lucky that we have 70 to 100 applications a year. A lot of departments don't have that, but we do have a lot of applications that are pre-med students that want to do 3 months of service with us. And we all know that the commitment that it takes to train and onboard and get somebody independently doing EMS care or fire suppression takes a significant amount of time. So we've, over the past few years, really developed a more structured program. My position was brought in at the request of the volunteers, and I was a volunteer at the time, to help kind of build a system. And we used resources from NBFC and all over the nation, Virginia Beach EMS and others, to see what they were doing and what worked well. We didn't really recreate the wheel, but we took parts and pieces that worked best for us. And it starts from the day that they turn in their application. And for us, we only onboard 3 times a year, following the academic calendar in the summer. So we take applications year round, but when they turn in an application, they're immediately contacted by me. Often I do a face-to-face, come meet at the station, let me give you a tour, show you around, tell you what we need as an agency, what our community needs in patient care providers and firefighters, and if our expectations meet each other's. Often I don't invite them to interview after that. The volunteers corporation is ultimately in charge of selecting volunteers, but they trust me to kind of do that pre-scan or pre-interview with them. But it also sets up people who might turn in an application today, but our onboarding has already started for the summer. We won't start them until August, just because we have 7 paid administrative staff and about 100 volunteers. Pretty small team to really get people rolling. So it's clear that if you turn an application today, you're so important to us. We appreciate you. Pre-meet with you, but you won't have a face-to-face interview with the volunteers or agility test until August. I do a couple drop-in emails to contact them, but they also, during that face-to-face, I give them the expectation timeline. We have an onboarding task book for all new volunteers, whether you're EMS division, fire division, or EMS driver, or our 3 kind of positions. And they have 90 days to complete that task book and to get those patient contacts and calls and hours established. I do 30, 60, 90-day check-ins, and we typically let go at least 2 to 3 out of anywhere from 10 to 20, depending on how big our onboarding group is, or 25. So if they don't meet those objectives, they're invited to resign or suspended, just because we don't have the resources to have people in all kinds of different statuses. I know that's different for other departments, but because we have a constant revolving door of sorts of students and community members that are partners of students or that leave, and we have called it a transient community, I guess, of a university town, we have to have those very specific objectives. It's also encouraged people to just go ahead and withdraw their application. They're like, I'm only going to be here for a year, or I have organic chemistry and all these other hard classes I can't onboard, and everything. We tell all students that, and last group we onboarded somebody in their 70s and a lot of people in their 20s, and we just have a mix, but students, we emphasize that it's a 4-credit class to start our onboarding and task book process and to get the requirements needed. So all of those are set ahead of time. There's a minimum requirements that are enforced. I help the volunteers enforce them, or give it to the volunteer command staff to work with their people. But that helps the volunteers who are giving so much know that everybody is at least meeting the basic minimums. They're not just there to wear a t-shirt, which historically, when I was a volunteer 15 years ago, there were a lot of people in the department that had been there a while that were just, I go on 2 calls a year, but with 3,000 calls a year in our agency, we need people who can meet those expectations and maintain those training and participation requirements. So,
wow. Yeah, a lot of great information, and I want to touch on a few points that you made.
yeah.
One, I love that you talked about setting those expectations right up front. I think that's important, whether you're a career or your volunteer department, no matter what type of organization, setting those expectations up front to let people know is so important. The other point that you made that I thought was really great is that we don't have to create things from scratch. There are so great resources throughout the country that we can borrow those resources and tweak them to make our own. And I always pick on New York. So FASNY in New York, they have a really great Recruit New York weekend where they do the open house across the state. I'm like, everybody should duplicate this. This is such a great program. Don't recruit it, don't recreate it, but go out and see what FASNY is doing and duplicate it. So yes,
absolutely.
other states. The other thing that you mentioned, I think is so important, is that we have to stop taking somebody just because they have a pulse. We have to make sure that we are bringing and onboarding the right fit for our organization. I love that you're screening them, because it's a lot harder to get somebody who's a bad fit
absolutely.
to keep them from coming in the door. So I think that is important. And the other thing that you brought up that I think is phenomenal is that quick introduction. If somebody does have an interest, and it's going to take some time to onboard them, invite them to the station, invite them to have a cup of coffee, give them a tour, and let them know how long it's going to take before they get to the process. Let them know what the process is. That way you can engage them quickly and they don't lose interest. So I think that's great stuff that you're doing. Thank you so much for sharing all of that.
Thank you.
All right, now let's move over and have a conversation with Jules. So, Jules, so a toxic culture and environment popped up in my study to being a huge barrier to recruitment and retention. Nobody wants to work in a bad environment, and they definitely don't want to spend their time away from their family volunteering in a place that is dysfunctional and toxic. Can you talk about what you've experienced with culture and environment and how you feel that ties to recruitment, retention, and what are some best practices to create a positive culture?
Well, first of all, it goes back to the fundamentals of recruitment. I mean, if you've got a culture, if you have a toxic environment or a culture in your within your service where people don't get along, where there's always griping or there's walled off cliques where certain people are always I'm only going to work with this person or I'm only going to work with that person or they're talking about each other all the time and that goes out into the public because they're talking about that out in the public, then when you go to recruit within that public, they hear that. And so that right there is going to be a deficit that you're going to have to work against right away because there right away you already have that negativity in the public. And you've got people that are just going to say, I don't want to work in, I don't want to come into that environment. I don't want to be a part of that. Because if they're talking about those people to me, then that means somebody's going to be talking about me to other people out here. So that's already put you way behind the eight ball where it comes to recruitment and retention. Recruitment and then retention, because nobody's going to stay somewhere in a toxic environment. Or if they
Right.
are, it's just going to be miserable the whole time. And that just then feeds into everything. It feeds into your education. It feeds into how well a person can do their job. It feeds into attendance at education, attendance at meetings, attendance into any kind of a get together, whether it's a fundraiser or any kind of a team building that you want to do. So that really that culture of positivity that you want to build in your workforce, whether it's volunteer or paid, is really the fundamental that you have to build, whether you're volunteer or paid, that's going to keep people there. And that's going to be really the foundation of any kind of a recruitment or retention program. So for us, I have worked in places and I unfortunately had to be the director of places that when I walked into it, as a new director, it was already so fundamentally toxic that it was almost impossible to do anything with it. And you would bring people in, and you'd thinking that, well, we get some new people in here, and we're going to kind of change that culture. And there were certain people that you had to kind of weed them out. But it's still that culture just stays there because unless you turn over everybody or you turn over the whole culture, and that just keeps kind of seeping in there. And so in some cases, it just takes an entire turnover of staff in order to get rid of it. And you have to build it from the ground up. So you have to, from the top down, you have to change that culture into not just ensuring that there's no negativity. Nobody does bad. Everybody's there for the right reason. And you have to make sure you're constantly reinforcing that. So always have those rules. In our service, we don't. There's no talking about anything bad that happens. There's no bad that happens. There's always learning. So nobody does anything bad. If there's a problem, it's something that we learn from. It's not that somebody did anything bad because nobody does this job to make a mistake. Everybody, something happens. It's always something that you learn from. You also don't discuss it because let's face it, that's not what this job is about. This job, we're not supposed to be discussing things outside of our little family anyway. So we always make sure that anything that we take out into the public is positive. And I think that the more cohesive you are as a group, then the more positive you will always be as a group. And that's the picture that you want to take out to the public. And so that's what we have found, that the more that we can show the public that we are a cohesive, family oriented group, that we do things. We do fundraisers together. We have every couple of months we have a picnic or we have a get together that our families go to. We invite the public to them. We do classes that we invite the public to. We're always showing the public that we have a positive environment. We go to other organizations that have events going on. We have one or two people that go to that. We also started recruitment at the grade school level. The grade schools have usually have a career day that can be kindergarten through second grade, can be second through fourth grade. We send an ambulance with stickers, first aid books, whatever, and we always send an ambulance up there. And people, we have coloring contests, and then we take them and put the pictures all over town, and let the kids, see their work plastered on the pictures all over town. And we talked to them about how they can become an ambulance, part of the ambulance service. And we've been really fortunate that we've talked the school into always talking about how important service back to your community is, so that they talk about that in their classes too, at the high school level, whether it's ambulance or fire, or whether it's being a part of their city council, but that always being a part of what it means to be an adult when you're moving on. So we always try to build that culture of positivity and not toxic. And most of the people that we have we've got people on this ambulance service that have been here for 35 years, and they're in their 60s, but that's a testament to how positive the culture of this ambulance service has always been. Unfortunately, COVID is what took hit. That's where we lost a lot of our volunteers, and is a small rural community. It's mostly retired farming community, so there's not a big pool to pull from. Unfortunately, I wish I had Pam's group to pull from, and that we could, my last service that I was director, I've had a college in it, so I know what she's talking about, and that was a great pool to pull from. But we're grateful if we can get them for a couple of years, and that's the other thing that we look at, is that when we go out to recruit, we don't go out saying we're heroes, because we don't want it to look like that's what we are. We go out there and say, we're here to provide health care. We're here to hold somebody's hand when they're not feeling good in the back of an ambulance. So we always try to be realistic about what it is that we do. We may go an entire month and have 12 calls. And of those 12 calls, we may only transport one person. And the other 11 calls are us helping grandma up off the floor, or, helping somebody that can't get out of their chair. And that's just as important as that one person that we transported. But we try to make sure that everybody understands that's what we do from the beginning, and that's just as important to be a part of that. So this service is the person that we did CPR on for 35 minutes.
Yeah, Jules, you brought up so many great points. And what I love about this panel is that all of our panelists have unique differences about their area. And so I think that's great, because other people on this webinar roundtable, they can relate. So it's so great that you shared some of those. And one of the things that I absolutely love that you shared, Jules, is that instead of looking at things as a mistake, people look at things as a mistake. You look at it as a lessons learned. And I think we know people want to be successful at what they do. And if they're successful, then our organization's successful, and it's up to us to help them become successful. And one thing that, I think that we can do is having a mentorship program. And Maryland actually came out with a really good mentorship guide. I dropped it in the chat. And I always tell people, when they talk negative about another person within the organization, I'll look at them and say, well, Well, did you mentor them? What have you done to help them be successful? To try to spin that negativity back into a positive. What have you done to help them? So great information. The other thing that I love that you brought up is you talked a lot about team building and involving the family, and we know that that is so important. And the MVFC is getting ready to release our updated family guide. That'll be out next month with Paul Combs doing the artwork for our cover. So that'll be out at our training summit. You'll be able to download that from our website. And what Jules said about, engaging the family, doing things as a team, really building those relationships, that is so important. And we know that that's important for recruitment and retention. So great points, Jules. Thank you for sharing those. And in speaking, of kind of some of the things that you shared, our volunteers all have unique needs and motivating factors. What does that mean for your recruiting efforts? Is there a one size fits all, or when you're recruiting people, how important is it to meet people's needs?
I think the biggest thing you have to remember is that there isn't one size fit. Then no one thing works for everybody. It might work. What you've been doing might work 1 month, and the next month it's not going to. It's there's no one strategic plan that's going to work every single time. You have to be prepared to change it and to just do what's going to, if it doesn't work this way, then try it another way. And you just have a kind of a toolbox of different things that you're going to try, and be prepared to keep changing that up. You could maybe try, you invite. I'll tell you one thing. When I was first approached, back in 1909 to do this, it was a threat, is really how they recruited. It was like, if you don't join your local ambulance station service, we're not going to have it anymore. And so and that was their recruitment. That was the sole way they recruited people. And so you did it because you thought, oh my gosh, we're not going to have an ambulance service if I don't do this. And did they get people? Sure. But most people went through the class and they did it for maybe a year or two and they were gone. Very few people held on. And I think statistically, it was looked at several years later that that was not an effective recruit and retention tool. It just wasn't. People doing it under threat were not people that were going to stick it out. And they weren't really doing it for the right reasons. So you want to recruit people in a positive way, and you want people to be doing it for the right reasons, because we don't want people to just do it under threat. We want to motivate them to do it for the right reason. But again, we want to just look at different ways that can do it. It could be just taking a couple of people on a ride on. We had a few years ago, one of our ambulance, we were out looking at the building that we were going to try to put an awning over a door. And one of our EMTs, his nephew was walking by. He had just moved back home and he was walking by, and we all jokingly said, Nick, you should join the ambulance service. And he said, okay, as a driver. He's now in a paramedic class. I mean, it was just, sometimes there's something as simple as that, so it can be something simple, and it can sometimes take a little bit more work. The biggest thing is be honest about what you do. Don't try to color code this and make it sound like it's Johnny and Roy from Emergency or Rescue 911, because that's not the majority of what we do. And so if you get kids, you want to get the young ones excited about it. But if you're in a rural ambulance service that doesn't have a high acuity of calls, or most of your calls are, grandma from the nursing home, you got to be honest about that, because you're not going to keep them if you're not.
Thank you, Jules. I think that is important. So often as people are looking to join, they have kind of this Hollywood idea in their mind of what it's going to be like. But the thing is we know this, that we truly have the ability to make a difference in the people's lives within our community. And it might not be the Hollywood version, but what we do, and I'm sure, when we're with people at their, some of their worst moments and being that supportive person, it makes a difference. And that value is just absolutely phenomenal when we think about it that way. And as we kind of transition into the last 15 minutes together, we've got some questions. So let's start. So, Pam, are your live-ins allowed to stay throughout the year?
Yes. We have 10 right now at my station that are the ones that are staying over the summer. They're working wildland fire, that kind of jobs, and they're required to do 24 hours of shift coverage a month. So normally they're on shift every 5 days during the academic year, but to live in the dorms, it's free. It's 24 hours a month, which is really usually pretty easy for most of them, unless they're on wildland.
Well,
So,
thank you. Yeah, that what a great benefit for folks. I'm coming and moving.
yeah.
So
You'll have a roommate. Sometimes they don't get along, but
um,
they're all great.
so and speaking of that, not getting along and things like that, can you describe a little more about what your minimum requirements and onboarding looks like?
Yeah, so student resident volunteers, all the live-ins, they onboard with us in July, August, right before the academic year starts. And they're every day, 8 to 5. We do all kinds of team building and hiking and pumping and driving and all that, the operational things, but also getting to know each other, how to wash dishes in the dishwasher and do laundry, because a lot of them are college freshmen that have never done any of that. So their onboarding is a little bit different than our regular, we call them regulars, our community members, who are also, some of them are also students. And those start January, June, and August. And we onboard them differently from the student residents, but they get a couple task books, and almost their entire training team is also volunteers that have know the expectations, know the timelines, and can help with all the different objectives, getting them signed off. But and they have to meet at least 24 hours a month on an online system that we use. And if they don't, there's opportunities to have a conversation for a month or so. And then after that, it's like, you're not meeting the needs of our community. We need you to be at this level. Here's the open door, essentially. Or please resign and apply when life works out for you to meet these needs. But hopefully that answers some of the questions. I am happy to share any of our task books, any of our all of the stuff that we have as an agency. I'm happy to email it to anyone if they want to look and see what we do and what our policies are on different things.
Great.
Happy to share any of that.
Yeah, and I think there's someone in the chat that does have has a question about the task booking. So Ian, if you want to drop an email in the chat, I'm sure
Absolutely.
they'll reach out to you and get a copy of that. So thank you for being willing to share that resource so others can
Oh,
learn.
yeah. Absolutely. And again, I copied a lot of it from other departments. Like everybody, nobody wants to recreate the wheel. I took what fits and from all kinds of different agencies and NVFC and made something that worked for our community. And I encourage everyone to do that as well. Network with each other and share resources, because we're all just trying to take care of our communities and take care of our volunteers, and anything that you can do to help each other out is huge.
So great. Well, thank you. And I noticed in the chat, and there was a question asked about learning how to join EMS from Logan. So Logan, I'm not sure what state you're from, but drop your state. Somebody here might be able to help you. But I also posted our Make Me a Firefighter website. You can check that website out, and there's some volunteer opportunities posted, but we can definitely get you connected to somebody in your state if you drop what state you're from. I guarantee somebody here will jump on that. So Eric, let's talk about training. Do you have like you bring the training locally, which I think is phenomenal. That's how my training was. And but do you have a difficult time getting a minimum number of students to host those trainings? Or are you like partnering up with some neighboring departments? What are you doing to make sure that you can, have enough students to offer that training? And are you having issues getting instructors?
Yeah, those are great questions, and I think it was Cassidy that asked that question in the Q&A. Yeah, I mean, certainly it's hard to put on a class, right? It takes the same amount of man hours to teach one student as it does to teach 10, and so we certainly would rather have more students and get a better bang for our buck. And so, and we're starting to when we don't have enough students, reach out to neighboring services and kind of combine our collective efforts. We're utilizing this technology right now during this webinar to be able to hold, hybrid classes, utilizing, a combination of 3 or 4 departments, each having maybe 1 or 2 students each, and each department sharing the instructing load that we can do the didactic instruction over this type of platform like we're using today, and interact with students that may be 20, 30, 50 miles away, and then coming together and doing the psychomotor hands-on stuff, um, or having each department do those types of things with the 1 or 2 students in their each of their zones, and coming together. So anytime you can pull those collective resources and utilizing neighboring departments that each may have just 1 or 2 students, it's a great collaborative effort to be able to say, hey, we're going to put on a class who has students, and between 4 or 5 organizations, now you have 4 or 5 organizations that can provide instructors, and also 4 or 5 organizations that can contribute to the student pool. And so, yes, we certainly don't want to put on a class just for one, because it takes a lot of effort. So if we can kind of have those collaborative efforts, it makes those classes much more beneficial for everybody involved.
In collaborating with your neighboring department is so important, because we work together, and that's a great way to do it. So thank you for sharing that. And just real quick, for everybody asking for the task books, Pam put her email in the chat. Please email her directly to make it simple on her, so she can just hit reply. So that way she doesn't have to go through it and pull every email. So yeah, please utilize her email and send her that email to make it much easier on her. So, because we're grateful for her taking the time to be here. So, all right, we got time for a few more questions. All right, so this one comes from California, and so their question is, what is the best path in dealing with the state to move the needle on allowing us to staff a BLS ambulance? It seems like a huge task for a small staff of 3 people to deal with large government as California. So how do we staff our ambulances with ALS? Jules, and Eric, you come from volunteer departments. How are you making sure that you have your ambulances staffed with your volunteers to meet whatever needs that might be?
Well, you're going to have to deal with the California authority. I mean, you're going to have to deal with your authority in your area, whatever their rules are for that. I mean, that's a
Yep. And reading through
yeah.
that question, it looks like they're having problems with policy and legislation. And so what I would just say to you is, you're not the only area in California. I think this is from Anthony, that is having this same problem. So I think if you reach out to other areas that need to staff ambulances with volunteers because you're not being served, sufficiently from outlying communities, is get together with other areas, and each of those areas are represented by certain legislators, right? Get those legislators together, tell your story about how your community is impacted because you're not able to staff your ambulance with volunteers because uh, your legislative authority is not allowing that. Your state office of EMS is not allowing that. So get those legislators that represent your local areas together, and you can get, so where California is a large government, but there's a lot of rural areas in California. And so if you can get these communities together and these legislators together to say, hey, we have a common problem. We need to staff our ambulances with volunteers so we have better service in our small communities, and let them go to work with the legislative process and the policymakers. And that large government suddenly becomes small as you're telling your story, and those legislators are able to get other people on board with trying to facilitate change in your community. So it might be a large government in your state, but take a small bites at the apple, get your partners together in other rural communities that have the same problem, and tackle the problem together. And hopefully you'll have success in allowing the state allowing you to staff ambulances with volunteers.
Thank you, Eric. And that is why you are such an expert.
I coordinate the National EMS Memorial Bike Ride out in California in the fall, and I do know that California is broken up into authorities. So you have different regional authorities out there. So I would say check with your regional authority that you're under, see if there's other volunteer services that are under that authority. And that would be your first step, would be to get those other volunteer services into that authority first instead of trying to take on the whole state. First, check with that authority that you're under first.
Thank you, Jules. And I have a question for you that popped up, and I think you'd be the right person to ask. So let's talk about EMS as a revenue stream for a fire company. How important is that? You think, or versus
Fire company?
yeah, to help fund money into the fire department by, I know in our area we run EMS as volunteers. None of us gets paid, but we bill and all the money comes back to our department. So the question came up about, using EMS as a revenue stream to help offset some of those costs.
Well, I mean, yeah, unfortunately, EMS, until starts getting paid for not transporting, all you can do is bill for transport. But I would say if you can afford to go with a billing company, and this is coming from someone that did the private billing for an ambulance service for many, 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 many years to try to save money, it is no longer conducive to a small service to do that yourself. It looks like it would be, but the truth is the rules, Medicare rules, have made it really tough for small services to do their own billing anymore. And we've now outsourced our billing to a billing company that has actually, they're actually getting us a lot more money because they have ways of billing for items that we were not able to bill ourselves. So, and they are not charging that much. They're only charging us like 8 points on like 8% of what we would get. So they're not really charging us that much. Also, I don't know now how many states are doing the GEMT, where you can get reimbursed on your Medicaid, primary Medicaid, that you normally would have to write off. But check that out in your state to see if you are. And that needs to be something that if your state is part of that program, you need to be doing it, because that's like most of us are writing off $800 to $900 for Medicaid, because Medicaid's paying like $100 and some dollars is all they were paying on a bill. And if your state is participating in the GEMT program, you need to be participating in getting that money back.
Well, thank you, Jules. And I heard some strong points there. One, make it easier on yourself. Using a third-party service allows you to have an expert that knows the rules, can get you more money, and then it's less
with the insurance companies.
Yeah, and it's less resources on on your volunteers trying to manage all of that. So thank you for sharing that. So we are 2 minutes from the hour, and we know starting on time and ending time is important. So I have one last question. I'm going to pitch over to our chair of our EMS rescue section, Eric. And Eric, how do you get your organization to change?
Well, I think if you want your organization to change, you got to be the change, right? That's first and foremost. And I think, I know if you're talking about trying to get your leadership to change, that could be more difficult. If you are the leader, you certainly need to be the change that you want to be. And it starts with at the top with leadership and the examples that we set. If you're trying to get your leadership to change, I would also say that you need to be the change that you want to be, and provide that to your leadership about what those changes need to happen. Certainly one bad apple can ruin a whole barrel, right? But also so much can grow from a good apple. And with the examples that are set, and a positive personality, a positive influence can be very toxic too, in terms of when I say toxic, it can spread as well and affect other people to say, man, this person is what I want to be like. And then 2 people have changed. And then it goes to 4 people have changed. It's not easy. I understand that. But just in short, as we're closing up, be the change that you want to be, and start with that.
Oh, I love that. Be the change you want to be. The other thing I would add to that is use data. Data can help drive change. So if you're not in a leadership position, show the leaders the data on to help support your case. That tends to help as well. So we are finishing up. We're at 3 o'clock, and I would like to thank everybody for participating, our great panelists, our experts that shared their knowledge, all of our great participants. I love seeing you guys active in the chat. You can continue that conversation onto our volunteer voices through our membership portal. Check that out. Have those conversations with one another. Keep the conversation going because we can learn so much from one another. So again, thank you, Pam. Thank you, Jules. Thank you, Eric, for your participation and insight. And again, thank all of you for participating. Stay safe out there.
Thank you.